Silver-sulfadiazine cream USP. Description: Silver-sulfadiazine cream is an antibacterial cream for tropical use. Composition: Silver-sulfadiazine 1%, water miscible base, methylparaben, propylparaben. Pharmacology: Silver-sulfadiazine has broad spectrum antimicrobial activity. It is bacterial against gram-positive and gram-negative bacteria including Pseudomonas aeruginosa and some yeast and fungi. It has a bacterial action in contrast to sulfadiazine to the silver salt act primarily on the cell membrane and cell wall, and its action is not antagonized by p-aminobenzoic acid. Pharmacokinetics: the silver is slowly released from the silver sulfadiazine molecule and can enter the systemic circulation. The sulfadiazine readily diffuses across wound and enters the general circulation. The degree of uptake will significantly depend upon the nature of the wound and the rosin regime. Sulfadiazine is extracted in the urine. Any absorbed silver may remain in the body for long period, predominantly in liver. It is slowly excreted over time via bile. Indications: silver sulfadiazine cream is indicated for prophylaxis and treatment of infection in burn wounds in patients with second and third degree burns, as an agent to short-term treatment of infection in leg ulcers and pressure sores, as an agent to prophylaxis of infection in skin graft donor site and extensive abstraction for conservative management of fingertip injuries. Contraindications: as sulfonamides are known to cause chronic hiccups, it should not be used in lactating women who are breastfeeding infant, on premature infant, or on newborn infant during the first 3 months of life. It is also contraindicated in patients known to be hypersensitive to sulfonamides and silver sulfadiazine or other component of the preparation such as cetyl alcohol or propyl glycol. Precaution and warning: prolonged use of an anti-infective may result in the development of superinfection due to organisms resistant to the anti-infective fungal colonization may occur. The product should only be used with extreme caution in patients with respiratory impairment or hepatic or renal function impairment. Caution of use is required in individuals known to have glucose 6-phosphate deficiency, as sulfonamides are known to cause hematite anemia in these patients. It may delay separation of burn eschar and may alter the appearance of burn wounds. Hepatic impairment: sulfonamides may be systemically absorbed when applied to the skin, eye, or mucosal membranes. Hepatotoxins, including jaundice, diffuse hepatocellular necrosis, hypersensitivity, hepatitis, and hepatitis failure, has rarely been reported in patients recovering sulfonamide. In addition, sulfonamides are partially metabolized by the liver and may accumulate in patients with hepatic impairment, renal impairment. Once absorbed, sulfonamides and their metabolites are eliminated by the kidney. Patients with renal impairment may be at greater risk for adverse effects from sulfonamide due to decreased drug clearance. Additionally, sulfonamide may cause renal toxicity secondary to cryptorrhea, including urolithitis and nephrocalcinosis and nephritis toxicity, nephropathy, hematuria, proteinuria, and elevated creatinine. Drug interaction: as silver may inactivity enzymatic debugging agent, their concomitant use may be inappropriate in large area burns where serum sulfadiazine levels may approach therapeutic levels. It should be noted that the effect of systemically administered drug may be altered. This can especially apply to oral hypoglycemic agent and to pinotoin. In the case of three drugs, it is recommended that blood levels should be monitored as their effect can be potentiated. Pregnancy and lactation. Silver topical should not be used on pregnant women approaching or at term because sulfonademics are known to increase the possibility of coronavirus. Silver sulfadine topical has been assigned to pregnancy category B by the FDA. Animal studies have failed to reveal evidence of phytotoxicity. There are no control data in human pregnancy. The sulfonamide concentration in breast milk is 15 to 35% of that in the serum. Sulfadiazine topical is only recommended for use during pregnancy when there are no alternative and benefit outweighs risk. Adverse effect. Local pain of irritation are uncommon. The separation of the ischia may be delayed and the fungal invasion of the wound may occur. Other infrequently occurring events include skin discoloration, burning sensation, rashes, and interstitial nephritis. Arterial leukopenia reported following prolonged use. Direction for the external. The Silolab cream can be applied directly to the burn area on a sterile gauze dressing. The cream layer should be at least 2 to 3 mm thick. It should be reapplied after all cream has been removed, preferably with saline. It should be applied under sterile condition. Treatment should be continued until satisfactory healing has occurred or until the burn site is ready for grafting. Overdose. Not likely to occur with normal usage. Storage. Do not freeze. Protect from light. Keep out of reach of children. Keep container tightly closed. Store at a temperature not exceeding 30 Celsius. Presentation. 25 gram and 50 gram cream in an aluminium lacquered collapsible tube in a cotton